a high-velocity thrust for a right-on-right chiropractic adjustment procedure applied. That is, the left lateral aspect of the sacral base has shifted forward and the right ILA has shifted backward, clearly palpated. In other words, we have a single central axis here, precisely where it is leaning backward at the ILA and forward at the base. First, I palpate the base with one hand here and gently flex it until I can feel the base move back into my finger here, steadily. Then the patient places his hand here on the trunk near the chest in this region. I perform a right lateral bend by gripping the left shoulder and pulling that shoulder upward toward the end of the bed, specifically toward the head end, here in a controlled motion with careful, deliberate control. Then I palpate again once more at the base and perform a flexion rotation here. But I do not lift up in this particular way. I basically just pull the arm down toward myself in order to achieve a flexion. After that, he stabilizes himself by resting on his elbows, maintaining balance and readiness for the subsequent adjustments as he carefully positions his upper body for the procedure. I palpate the base and gently flex it, ensuring that the sacrum's base on the left side is indeed moving forward toward my finger here, as I guide it with slow, careful, steady precision. Then you gently extend the lower leg, and I can somewhat fine-tune the position by pulling it a little farther back here for adjustment for proper alignment and comfort. Then I bring him out over here with a rotation, and I press his right ILA down toward the bench, which in turn causes his left base to come up. Take a deep breath now, please. I am stabilizing here, and I can, by the way, do this by asking him to turn his head so he looks up at the ceiling. Then there should be no movement up here. My forearm here on the right side really stabilizes his trunk. You try to take another deep breath and fully exhale. So I identify the exact point here, and then the pressure moves downward.